Hello, inquisitive viewers, and welcome to my channel. Today we're diving into a fascinating and thought-provoking topic: gender selection. This is a subject that's been a source of intrigue and discussion for years. In this video, we'll explore the science, ethics, and various methods of gender selection, and delve into the reasons why some people choose to use these methods. But remember, it's a complex issue with ethical considerations, so let's jump right in and discover what gender selection is all about. If you're curious and ready to learn, hit that like button and let's get started. Gender selection is a topic that's garnered attention and raised many questions over the years. Today, we're going to delve into the various aspects of gender selection, from the science behind it to the ethical and cultural implications. Part 1: Understanding Gender Selection. 1. What is gender selection? Gender selection, also known as sex selection, is a process that allows individuals or couples to choose the sex of their child before conception or during early pregnancy. This choice can be made through various methods, both scientific and non-scientific, to influence the gender of the offspring. 2. Scientific methods. Scientific methods involve assisted reproductive techniques such as in vitro fertilization, IVF, combined with pre-implantation genetic diagnosis, PGD, or pre-implantation genetic screening, PGS. PGD and PGS allow for the selection of embryos of a particular gender before they are implanted in the uterus. This method is often used for family balancing or in cases where specific gender-related genetic disorders are a concern. 3. Non-medical methods. Non-medical methods for gender selection typically focus on timing intercourse to coincide with specific points in the woman's menstrual cycle, which can influence the likelihood of conceiving a child of a particular sex. Some people believe that sexual positions, dietary choices, and other non-scientific factors can also play a role in gender selection. However, the efficacy of these non-scientific methods remains a topic of debate and often lacks scientific support. Part 2: Reasons for gender selection. 4. Family balancing. One common reason for gender selection is family balancing. Some parents may want to have a more balanced distribution of boys and girls in their families. For instance, a couple with 3 daughters may choose to use gender selection methods to increase their chances of having a son. 5. Medical reasons. Medical reasons can be a driving force behind gender selection. In cases where specific genetic disorders or medical conditions are linked to a particular gender, parents may choose to avoid passing on these conditions by selecting the sex of their child. 6. Cultural and social influences. Cultural and social influences also play a significant role. In some cultures, there may be a strong preference for having children of a particular gender due to historical or societal factors. Such preferences can influence an individual or couple's decision to use gender selection methods. Part 3: Science and Ethics of Gender Selection. 7. Ethical concerns. Gender selection is a topic that raises various ethical concerns. One major concern is the potential reinforcement of gender bias and stereotypes. The practice can perpetuate societal expectations and discrimination based on gender. There's also the ethical question of whether it's appropriate to make choices about the gender of one's child as if it were a consumer product. 8. Gender equality. The issue of gender equality is crucial in discussions about gender selection. Critics argue that gender selection can contribute to gender imbalances and exacerbate gender discrimination. It's essential to consider the broader implications on gender equality when discussing these methods. 9. Medical and safety risks. Another aspect to consider is the medical and safety risks associated with some gender selection methods. Non-scientific methods, in particular, may not be entirely safe or effective. Risks and potential complications should be thoroughly evaluated when choosing these approaches. Part 4: Future of Gender Selection. 10. Advancements in technology. The future of gender selection will likely be shaped by advancements in technology. As science and genetics continue to advance, we may see more accurate and reliable methods for gender selection. These developments may offer new options and considerations for those who seek gender selection. 11. Ethical discussions. The ethical discussions surrounding gender selection will remain at the forefront. As technology advances and practices become more common, society will continue to debate the implications and ethics of gender selection. It is essential for individuals, healthcare providers, and policymakers to consider the moral and philosophical aspects of these choices. 12. Cultural shifts. Cultural shifts are inevitable, and attitudes toward gender selection may change over time. As societies evolve, what is considered acceptable or ethical may shift. The acceptance and regulation of these practices could also undergo changes in response to cultural shifts. Gender selection is a complex issue with various dimensions, from scientific methods and reasons for its use to ethical concerns and the potential future developments in this field. It's a topic that demands thoughtful consideration and open dialogue. By understanding the nuances of gender selection, we can engage in more informed discussions and make choices that align with our values and societal considerations. Thank you for joining us today. Remember, gender selection is a multifaceted issue with both scientific and ethical dimensions. Stay tuned for more thought-provoking videos, and we'll see you in the next one.